Our focus of the studies was the effects of nicotine versus marijuana. A large portion of the people who use nicotine and marijuana consists of adolescents and college students. In a survey conducted across the US, 75.5% of students reported having used e-cigarettes and other vape products. Because so many students are using these substances, it's important that we understand how it may be affecting them mentally. Smokers are more likely to have or develop depression over time than non-smokers. There was also some positive research that had been done that showed that nicotine may improve memory in healthy individuals by strengthening the synapses between neurons. With this information, we decided to explore the effects on depression, motivation, concentration, and social behaviors.
A person who smokes marijuana and nicotine is more likely to suffer depression than a person who does not. The independent variable is people who smoke marijuana and nicotine. The dependent variable would be the amount of times they smoke in a day. To test this, you would have to analyze the percentage of respondents who are depressed and smoke marijuana versus those who are depressed but do not smoke marijuana and/or nicotine.
Hypothesis number 2. If adolescents start smoking or vaping, they are more likely to try narcotics. Our independent variable is adolescents that smoke or vape, and adolescents would be anyone between the ages of 10 to 19, and daily smokers or vapors that could be considered addicts. Our dependent variable is trying narcotics. For example, codeine, fentanyl, hydrocodone, or morphine.
Hypothesis number 3 is adults that smoke nicotine are more likely to develop some form of cancer than those who consume marijuana. The independent variable being nicotine and marijuana users, the dependent variable being the percentage of participants who have cancer. Constructs would include the frequency, like how often either substance is consumed daily, and like a trigger. Any situation experienced throughout the day that could inspire that kind of use.
Hypothesis number 4. Adolescents who use nicotine while studying will report better concentration levels. The independent variable is the use of nicotine while studying. The dependent variable is concentration levels. Concentration levels are defined as the ability to direct your attention to studying without being distracted.
Methods of data collection. Our participants included 100 Long Beach City College students between the ages of 17 and 25. There were 42 females and 58 males. The participants answered survey questions about their use of various marijuana and nicotine products, as well as their motivation and self-reported effects. The last 5 questions included Likert scales to assess the participants' association with marijuana and nicotine and relaxation and focus.
So the results and findings out of the 100 participants for all hypotheses, 72% reported that smoking marijuana and nicotine helps them feel good, and 87% reported that smoking helps them when they feel depressed. Those same participants that smoke vape or smoke marijuana products, 16% reported that they would try narcotics if given the opportunity. Out of the same subjects or participants, 63% said they know of people, friends, family, etc., that have or had cancer as a direct result of smoking. 63%, out of that 63%, 24% was contributed directly to marijuana and 39% was contributed to nicotine. On average, the amount of students who smoked before and or while studying reported higher levels of concentration than those who did not. Students who reported smoking marijuana while studying reported lower levels of concentration on average.
Some conclusions from these studies were that there is a wide range of reasons why people use nicotine and marijuana. There were some positive effects related to the use of nicotine and marijuana. For example, they were used to feel good, help anxiety and depression, and to fit in with friends. The use of nicotine can raise levels of concentration. This could potentially help treat people with ADHD to help manage their symptoms. Smokers are at the highest risk for developing cancer. Our survey showed that more people know someone affected by cancer as a direct result of smoking tobacco than as a result of marijuana.
Further directions, shortcomings, and limitations. Future directions. While nicotine and marijuana did show some negative health implications, the study revealed some positive effects. Future studies might focus on the benefits that the substances can have on specific groups. Shortcomings. Some of the questions in the questionnaire would have provided more insight if the response options were converted to Likert scale instead. Our survey could have included more demographic questions. Some of the limitations were that the participants were only from LBCC. Students also may not feel comfortable answering questions about the use of nicotine and marijuana at school. Lastly, self-reported effects are not as strong as experimental data.